Well, welcome to Focus Today. I'm your host, Perry Atkinson, and today delighted to introduce to you a new friend. We have TimMacCurdy with us today. He's with Ventana Wellness, and he's a dermatology specialist. Am I saying that right, Tim?
That's correct.
Nice to have you with us.
Thank you.
Welcome, and welcome to the Valley and to Southern Oregon. It is a pretty place when you can see it.
I've experienced that.
Once the smoke clears, it's great. Well, we want to talk about something that we should all be concerned about, and that's skin cancer and the issues of skin. First of all, just the obvious question, is this smoke hazardous to our skin? And
The smoke is not in and of itself probably very hazardous to our skin. And anything that blocks the UV rays is going to be slightly protective.
Yeah, okay. But skin cancer is always a concern, and you hear numbers that are up, that are down, people who react, overreact. Is skin cancer rates, is it increasing?
Skin cancer rates are literally through the roof, up
Really?
about 300% over the last couple of decades.
Wow. Why?
Well, probably starting post-World War II with the increase in recreation. Water sports, tennis, golf, cycling, and a lot of people tanning, there's been a lot more UV exposure.
Wow. And we see all of these skincare products on the shelves, and I don't know if you want to get into that, but are they working?
Yes and no. To the extent they're used, they're certainly working.
Yeah.
There are a lot of products out there. It can make you dizzy just looking at the shelf. And so I really try to simplify things. I usually recommend an SPF 30 for my patients, and I prefer sunblocks over sunscreens. The difference being sunblocks have either zinc oxide or titanium dioxide as the first or second ingredient. And you should apply them about every 2 to 2.5 hours, and about a shot glass for the entire body.
Wow.
That's the way to think of it.
All right, so what should we be looking for when it comes to skincare? If you have irritation, I mean, obviously you check those things out, but what should we be looking for? Any lesion, a mole, a suspected mole that's changing should certainly be evaluated.
We tend to produce moles probably right up through our late 20s or so, and after that, it's much less likely we'll produce new moles. And so any quote-unquote new moles at that point should be evaluated. Okay, or different coloring of skin? I mean, how do you tell the difference between skin cancer and a rash? Right. Skin cancer typically is focal, so there'll be much smaller lesions. And what we'll usually see in people, let me separate things for just a moment.
Sure.
We have probably 3 main types of skin cancer: basal cell, squamous cell, and then melanoma. Melanoma is the most devastating of those 3 and accounts for probably about less than 5% of all skin cancers. That one is going to appear to the average person as a mole. However, the other 2 are going to typically present as small, red, scaly bumps on the skin in the sun-exposed areas: forehead, sides of the face, dorsum of the hands, and arms. Okay. Let's go back to those 3 cancers, skin cancer types, the basal and melanoma and others. Tell us the level of threat they are. Let me start with the most threatening and the least common of those 3, and that is melanoma. Melanoma, if found early, which is why we recommend routine surveillance about every year for people who have a lot of moles, is devastating if not caught early. People do frequently die from that. Basal cell and squamous cell, on the other hand, rarely spread. They're a localized phenomenon, and they can be easily removed, and we do that daily in our practice at Ventana Wellness. Okay. How do you do that? How do you remove those? We anesthetize with local anesthesia. And we have surgical instruments that we use to biopsy lesions, and then if a biopsy is positive, There are a variety of techniques which can be used to remove those skin cancers, from chemical means to surgical means.
Okay. I'm surprised that it's on a rise, and I guess it's because we're exposed, we're out there more, and we're maybe not even thinking about it. I've heard cases in melanoma where it does spread rapidly. Does it? Or can?
Melanoma, once it's penetrated beyond the superficial level of the skin, can spread rather quickly, and has a pretty poor 5-year survival rate if it's gone to a deep enough level.
So what about other than the blockage and the treatments that you buy over the counter, is there anything else we can do? Is any of this can be controlled by improving our diet, drinking more water? I mean, does that have anything to do with anything?
Not per se.
Okay.
I'm certainly an advocate for healthy living, and people ask me all day long what they can do to improve the texture or overall appearance of their skin, and certainly a healthy diet and exercise and drinking plenty of water are important. However, with regard to skin cancer, there's no question that a combination of avoidance, hats, wide-brimmed hats, shade, and the use of plenty of sunscreen and often is key.
Okay. What about makeup? I mean, women wear a lot of makeup. Is that a problem?
No, actually, and there are different makeups that are available that do have sun protective factor included, and a lot of my female patients are now availing themselves of that, and I do recommend that.
Okay. What can we do to prevent some of this? I mean, obviously, some of the treatments you have, but and you were mentioning hats and things like that, and they seem to be common sense, but it doesn't it's not bringing those numbers down. Those numbers are going up.
Well, unfortunately, there's probably a 10 to 50 year lag time or so between incidence of UV exposure, which obviously starts in youth, to the development of skin cancer.
Really?
It really. So it probably wasn't until the 1980s and really 1990s that as a society we've gotten more on board with the sunblocks and sunscreens. And so for the next decades, I would imagine that skin cancer rates will continue to increase, actually.
Okay. Back to the mole thing just for a minute. A lot of people have moles, but a lot of them are not cancerous. So what do you look for in a mole that could potentially be cancerous?
Well, that discussion becomes a bit complex for the layperson. However, what I have special lights and techniques for evaluating these moles, and honestly, often it comes down to a biopsy.
All right. Of course, if you see something red around and doesn't go away and it's sore, those are obvious signs.
Certainly. Anything that's scaling, crusting, certainly bleeding, and is not going away deserves to be evaluated.
All right. In light of these big numbers, are people coming to you as often as they should, or should they be seeing you more often?
Well, I'm very sympathetic to potential dermatology patients across the United States, but certainly here in the Southern Rogue Valley. The wait times to get in to see a dermatologist are 3 to 6 months. That's a problem. People who have new lesions should get in as soon as possible. Usually a month or so is fine. But regarding regular surveillance, about every year.
Okay. Can you develop skin issues that are not exposed to the sun?
Yes, you can. With regard to cancer, certainly you can. It's much less common.
Okay, because I've seen some people get it on their back and they were wearing a shirt, or they get it on the back of the leg where it wasn't heavily exposed to the sun or something like that.
It is certainly possible. The worst cancer, melanoma, is most commonly found on the back of a man and on the legs of a female, simply because of our clothes wearing patterns.
Okay. The other thing is that it appears to me that as big as this problem is, we're not taking it seriously. I mean,
certainly from my perspective in dermatology, it's rather shocking the rates of skin cancer that we're seeing, and I think even as we get, as a society, people on board with the sunblocks and shade, we're still going to be seeing increasing rates over the next couple decades because of that lag time to which I referred.
All right, let me take a break here. We'll be back, and we're talking about skincare, and if you have any questions, you're welcome to join us as well. I want to, when we come back, have you address supplements. Does that help our skin issues at all? We're hearing about vitamin D is good. Should we be taking more C, things like that? And we'll be back right after this. Okay, we're back, and delighted to welcome to the Valley and to the staff there at Ventana Wellness, TimMacCurdy. He is a dermatologist specialist, and very concerned about the rise of skin cancer all over the country. I guess these numbers are skyrocketing, Tim, and have you concerned. What else do you do as a dermatologist specialist besides look for skin cancer?
Skin cancer is probably the most concerning thing I deal with, but we deal with an entire variety of conditions from acne to contact dermatitis, that's allergic reaction to various chemicals or other substances that may find their way onto the skin, hair loss, inflammation around the mouth, lips, general dry skin, fungal infections, warts.
Yeah.
A variety of conditions that present as itchiness of the skin.
Okay, so if you got any kind of a skin issue, Tim would be a guy you want to see. I want to come back, to the sun issue. It's good because it gives us vitamin D. Too much sun can give us skin cancer. Where are you with supplements like vitamin D or C or others?
Well, I really advocate for sort of diet that your grandmother might have had. In my opinion, it's not rocket science. Plenty of leafy green vegetables, normal amount of protein, and plenty of water. But you did refer to vitamin D, and it's a bit of a catch-22 with vitamin D. We're increasingly aware of the importance of vitamin D with regard to a healthy immune system. And we do know that people who don't have healthy immune systems are more subject to developing a whole variety of cancers, but certainly skin cancer. The sun is the most efficient way to get vitamin D, usually 10 to 15 minutes of sunshine a day on skin that's not been treated with a sunblock is enough. But because of the increase in skin cancer rates, I think more and more of us now are advocating getting your vitamin D through supplementation.
Okay, and those amounts are varied, but
they are varied. We don't have great science on how much vitamin D a person should be getting. But I think it's safe to say that somewhere between, for the average person, 2,000 to 4,000 international units of vitamin D3 a day would be adequate.
Okay. And do you obviously consider that during the winter months?
Absolutely. Again, I'm coming from Washington State, west of the Cascades, where
you saw the sun every 3 years,
if that, and certainly the general population there is below normal, actually below healthy levels with regard to vitamin D. And I think you don't find that same phenomenon on the east side of the Cascades in eastern Washington. So I think supplementation with vitamin D during the winter here is advisable.
Okay.
Yes.
I want to come back to the second most common skin cancer. How do you pronounce it?
Squamous cell carcinoma.
Squamous cell. What is that?
Squamous cell carcinoma typically is going to present in the form of what's called an actinic keratosis, which is a lesion on the sun-exposed areas that is often better felt than seen. So a patient may come in telling me that they feel scaly spots on their forehead, particularly gentlemen with not a lot of hair up there on the sides of the face, dorsum of the hands, neck, shoulders. And from a few feet away, you may not be able to actually see the spot, but they can be felt.
Does it flare up?
They don't typically flare up, but over time, actinic keratoses, a certain number of them, will become squamous cell carcinoma.
Wow. So how dangerous is this?
Squamous cell carcinoma, like basal cell carcinoma, is typically not metastatic, typically does not spread. However, of the two, squamous cell carcinoma more likely to spread, and if it occurs on the lips or on the ears, more likely to spread yet. So these are very concerning areas for the development of squamous cell carcinoma.
Wow, okay. Just on general skin care, now you mentioned earlier of all the things you do in dermatology, from looking at these problems, obviously where it's so serious, but to acne and other things that young people go through, how important is it they get control of that while they're young?
Well, I think much like
I know it's a phase you go through, but it can scar too, can it?
Oh, acne certainly can be scarring, and it's disheartening when I see young people come in who, for whatever reason, have not been able to get in to see a dermatologist or have not had adequate care, and they have scarring acne, because we can treat that.
Okay.
We have ways to stop that.
Okay. And is that a long process? What kind of a process is it?
Again, there are a variety of means for treating the acne. The most intensive treatment that we offer for scar and acne typically is about 5 months long. So in the grander scheme of things, not too long, actually.
Okay. And I want to come back to the seriousness of skin cancer problem, because as you mentioned, the numbers are high. I've seen some big percentages you shared with us here. And you're including that some of these cancers combined can exceed breast cancer, prostate cancer, lung and colon. I mean, that's serious.
It is serious. And I think that it's increasingly appreciated by the American public that it is serious. I think that is reflected in the fact that it takes 3 to 6 months to get in to see a dermatologist.
Yeah.
So it's quite serious. But again, I think with the fairly simple measures of sun avoidance, hats, and adequate sunscreen, we can go a long way towards reducing that seriousness. Okay.
Well, I want to welcome Tim to Southern Oregon, and he's now with Ventana Wellness. Are you there every day? What's your work schedule?
I am there 4 days a week.
Okay.
Tuesday through Friday. You can find me anytime there.
Okay.
Those days.
All right, and that's the Ventana Wellness. By the way, you can go to ventanawellness.com and take a look at all the services that are there, along with Tim is Dr. Joel Klein, and of course we get a lot of response from him being on the show. And I just think this is something that we shouldn't just pass by. The skin cancer issue, I've had lost friends with melanoma, just went unchecked, and by the time they got on it, it had gone too deep and spread too fast. So it's serious.
It's a devastating disease when not caught early.
Okay, and the basal cell is serious. I know it's not as serious as melanoma, but can it become a serious problem?
It certainly can. It can potentially spread, and it can be disfiguring.
Wow.
I think in the dermatology field, we've all seen shocking cases of people who have had basal cell carcinomas, or squamous cell carcinomas for that matter, growing on even the face for some years, which might ultimately require the removal of an ear or most of your nose, your lips.
Yeah, it's big. Okay.
Yeah.
Well, Tim, thanks for coming in. And again, let me encourage you, Tim is with Ventana now, so you can call over there. He's Tuesday through Friday on staff. And I don't think you're going to have to wait 3 to 6 months to get in.
I can see you very soon.
Very soon. All right, give him a call over there. Thanks for coming in.
My pleasure.
Okay, we'll see you.
You.
We'll be right back here on Focus Today.